Hey, well, good afternoon, everyone, and welcome to the weekly seminar series at the Dahdaleh Institute for Global Health Research. My name is Professor Mary Viktorovich, and I'm the acting director of the Dahdaleh Institute for Global Health Research. Today, I'm delighted to host Professor Cary Wu, who will lead today's seminar entitled Public Awareness of One Health. As is our usual practice, I'd like to begin by acknowledging the indigenous land that we're on. So, as this is a hybrid event, some guests are on different territories, so please take the time to give thanks and respect to the land on which you're currently living and working. Today, we're here on York University campus in Toronto. York is situated on the traditional territorial area known as Tkaronto, and we acknowledge its current treaty holders, the Mississaugas of the Credit First Nation. We acknowledge this as the traditional territory of many Indigenous nations, including the Anishinaabe Nation, the Haudenosaunee Confederacy, the Huron-Wendat, and the Métis. This territory is subject of the Dish with One Spoon Wampum Belt Covenant, an agreement to peaceably share and care for the Great Lakes region. So let's begin with a brief introduction to our speaker, Professor Cary Wu, who is an associate professor in the Department of Sociology here at York, and he's also the York Research Chair in Political Sociology of Health. His research focuses on trust and health inequality, and it's appeared in many peer-reviewed journals, such as Daedalus, Journal of American Academy of Arts and Science, Public Opinion Quarterly, JAMA Network, and Ethnic and Racial Studies, just to name a few. Cary has also been featured on public TV and news outlets such as The Washington Post, The Economist, Toronto Star, CBC, and Bloomberg. He was a recipient of the Canadian Sociological Association Early Investigator Award just this year, so congrats on that. So in today's seminar, Cary will discuss the importance of the One Health approach, which is vital to global health governance and pandemic prevention, but requires integration and active participation from the public. He'll share the significance of promoting public awareness and present the findings from his survey concerning distribution levels of One Health awareness in China. And as this is a one-hour event that will end at 2, we'll start with a presentation by Cary for about 20 minutes, followed with a 30-minute question and discussion, and wrap up and conclude the seminar at around 1:55 p.m. So just in terms of, for our guests joining in person, there's microphones in front of you that will pick up the sound. And for guests who are viewing by Zoom, please note that this seminar is being recorded. Please mute your microphone unless you're presenting or answering or asking a question. And also, please use the raise hand button or chat function to ask a question. So I'd now like to ask Cary to begin. Over to you.
Thank you, Mary, for a very kind introduction. Thank you, everyone, for joining us. So today what I'm going to talk about is public awareness of One Health. So this is part of the bigger CRHR project led by Mary and Tara, and I'm part of this multi-year research project. And then today the talk will mostly based on the published article about public awareness One Health in China, but we'll do a little bit more than just this published research. So in general, 4 questions I'm trying to address here. So first is, what is One Health? Second is, why awareness is critical to the global implementation of One Health. The third one is, how aware is the public of One Health? And the final one is, did the pandemic raise people's awareness or interest in this One Health concept? So 4 questions. So what the question for you is, how many of you have not heard One Health concept? No, never. But for this talk, okay, never, okay. But I would assume most people, right, especially in health field, will heard about this concept. So what is One Health? So in literature, they largely think about One Health in kind of 3 kind of directions. One is thinking One Health as a theoretical framework is like recognizing the linkage, connections between people's health, animal health, and the health of the plants and environment, right? And then go from there. It's a vision that how One Health, like one, the concept, a vision. The second is thinking One Health as a methodological strategy, right? So how to research about health, how to talk about health. So it suggests that we need the integrative or not interdisciplinary, but transdisciplinary, right? Bring different fields together and then develop a more like a unifying approach to health inequality, or to global health, climate change, or those issues, right? So that's a second way of thinking in literature. A final way is more like a practical framework, thinking about what to do, right? For doctors, for policy makers, like what to do to address the rising inequality and also the pandemic. The way is like we need to collaborate with not just people working, professionals working for people's health, but also animal health and health of the environment in general, and then also working with different levels, local, right, community, and then of course regional and national, international, bring different countries together, right? So that's part of our CIHR grant is really global ways of thinking, global health governance. So that's kind of three ways of thinking. And then, for example, just lots of organizations and researchers have defined the concept in many different ways, right? So this is one definition from CDC, right? So One Health is a collaborative, multi-sectoral, and transdisciplinary approach, working at different levels, and then the goal is trying to achieve health for not just for people, but for animals, and then for plant and the environment, essentially for health for everyone, for the planet, for the earth. And then the key is recognizing the interconnection. And then this is just a couple of years ago, because there's so many different definitions, right? So we need to have one kind of definition to better work across disciplines and across sectors. So a couple of organizations, including the WHO, they came together to form a One Health high-level expert panel, right? And then the first meeting they held is really trying to figure out what's the definition of this One Health approach. So this is kind of like more like a standard definition now people often use. It's an integrated, unifying approach that aims to sustainably balance and optimize the health of people, animal, and then ecosystem, right? And working at different levels, bring people from different sectors. That in general give like a brief review of what is One Health approach. And then organizations also realize, or experts, research also realize, like how to really promote this approach, how to implement this approach. Like a lot of researchers argue this approach has potential to really prevent the next pandemic, right? But what will be the key actions to promote this approach globally? And then the first recommendation is really to raise awareness. People need to know this approach before we can really take actions and promote this approach worldwide. And then I've been thinking why it's critical, especially for the general public. 4 reasons. First is public engagement, right? So when we think about this approach, that we need to really think about people's health is connected to animal health and also health of the shared environment, that people, the general public, need to understand and engage, right? So their health actions, their lifestyle, health behaviors have to take into consideration of the interconnection between health of people, health of animals, and health of the environment. So that's first reason. Second reason is about political will, right? So when people are aware of this approach, then we will demand this One Health governance from politicians and policymakers, and that lead to the implementation and the promoting more. And third reason is when people are aware of this approach and then have positive attitude toward this approach, then we are more likely to really follow this One Health regulations and comply with One Health governance policies. And finally, I want to make the point is that One Health awareness itself is a critical determinant of health in general, right? So the idea of being aware of One Health will improve our health. Certain way is that when we have this awareness of our health is connected to our, for example, cats, dogs at home as pets, and also the park and all those, so we change everyday kind of health behaviors and actions, and that lead to better health, not just for yourself, but also for communities and then people at whole society. So that idea is that One Health awareness as a critical kind of determinant of public health and population health. In general, when we think about One Health, the concept itself is relatively new. It was proposed, the concept of One Health, the term, not the concept, the term of One Health, it was first used in 2004, where the WCS, they were holding a research symposium in New York, and then they developed this Manhattan Principles, where they highlighted one word, One Health, that to really protect animal health and the health of the environment, we need to work together. One word, One Health is kind of like the concept, the term was first used. But the idea, the core idea of One Health being long-standing, right? So more than a century ago, right? So the idea is rooted in one medicine idea, right? So for example, this is like the kind of founding father of modern medicine. He highlighted, right, between animal and human medicine, there's no dividing line, right? So the idea is one medicine, one pathology, and One Health. So third question is, how aware is the public of One Health, right? So when we think about, this is a very interesting line. So when we think about climate change, right, everyone knows climate change, right? But still, the concept of One Health. So this line is thinking that maybe One Health, even more, the term is more important than the concept of climate change. But everyone knows climate change, but not everyone are aware of the concept of One Health, right? So what we did is trying to figure out how aware is the public worldwide. So we did search all those research articles about One Health awareness, and this is, in general, some of those fundings, right? So for example, 92% of students, or medical students, they agreed that One Health was relevant, and then lots of people agreed that they heard about the term. Like for example, 64% of participants in this study, they heard about the term of One Health, and more 85. So in general, a higher percentage of people, they had a positive attitude or had agreed the idea of One Health, right? But the lower number have not heard of the term, but essentially they agree or have the positive attitude or agree the idea. So that's in general the kind of the funding in literature. And you will also see another pattern I wanted to highlight is about One Health research. A lot have been conducted not in Canada, USA, maybe one study USA, but a lot of in other countries, right? So that's also very interesting patterns. Why is that? We can talk more in discussion, but in general, the importance of, for example, researchers here and in US need to pay more attention to the concept. So general conclusion from the literature is that from professional communities, researchers, doctors, they have higher awareness of this concept, but lower in general among the public. And then second is that fewer people have heard about the concept itself, but more people are being more positive or have agreed the idea or recognize the core idea that people's health is connected to animal health and also health of the environment. So I turn to China, like why focus on China? One is, like I mentioned, not many research was conducted in major countries in like China, USA, and Canada, and even UK. So that the idea is focused on China's huge and lots of population, and then you can also see the timeline about like how the term was kind of like introduced in China. So right after 2004, there was also a conference held in China, in Guangzhou, about One Health. But in translation, it's interesting. When we think about One Health, it was translated in more than 15 different Chinese terms, right? So One Health is just two words, a term. But because people have lower awareness, including researchers, journalism, they translated based on their own understanding. So in the news articles, in the policy document, you see different terms used to refer this One Health concept, right? So that could lead to trouble as a theorist lost in translation, right? Because there's so many different diverse translation, then that will be bad for kind of promoting awareness or public, because they don't have the same understanding of the same term, right? So that's one kind of motivation to look at how aware is the Chinese public of this concept. So we used two types of data. So in summer of 2022, we did a survey in Beijing, the city. So the paper we published is based on the survey from Beijing. And we also did a survey, collaborate with local researcher in Wuhan. We also did a survey. We did not analyze yet, have not yet analyzed the data from Wuhan survey, right? But today I'm going to talk a little bit more about Wuhan survey. So in general, Beijing survey, the pattern is similar. About 40% of the sample heard about the term, and then you do see some variations, right? So younger people seem to less likely to see. The younger people are more likely to heard of this term, and then female, for example, more likely, and lower income actually more likely to have heard this term. So that's in general. But more than 80% Chinese public in Beijing sample agree that people's health is connected to animal health, and people's health is connected to health of the environment, right? So even though they have not heard the term of One Health, but they agree that the core idea of One Health is that this interconnection of people's health and the animal health and health of environment. But you also see some variations across gender, age, and levels of education. And then very similar patterns from Wuhan survey, right? So almost 90% of people agree that the people's health is connected to health of animals, and almost close to 90% Wuhan participants also agree people's health is connected to health of environment, right? So in general, you see similar patterns on this. The final question is, did the pandemic raise people's awareness and interest in the concept, right? So to answer this question, I explore the Google Trends. I'm not sure how many of you have used this Google Trends search, right? So what I did is I simply used this and searched the term of One Health. And this is, you can see, this is relative. This is 100% means most popular, relative, most popular. And then this is 2004, and then you see in general, we do see there's an increase since the start of the pandemic, right? So the huge search, One Health, the term online, worldwide, right? So that's over time, we do see some increase. And then, but we see the regional variation. You see those countries. And I was trying to figure out why. Why in those countries people search the term of One Health? Why? Any guess? Why in those countries? And I figure out because during the pandemic, they have this One Health registration for people traveling to this country. So in Canada, we have the app, right? So in Philippines, for example, they call that app called One Health Pass, right? You need to declare the symptoms, like your medical histories about the coronavirus to enter the country. So that's why, and then all those countries have this system. So that's the reason why. So then this means that this related trends cannot suggest that people becoming more aware or more interested because of that, right? That's just One Health, it's a different thing. But how to figure out that? So I look at only before pandemic, see whether there's a over time increase, right? So we do see some over time increase in the interest of searching this term, right? And this is regional variation, right? Top search in the U.S., New Zealand, including Canada. And also zoom in just in Canada, see whether, because we don't have that One Health Pass, the people don't search One Health because of that pass. And this also shows that in Canada, within the country, we do see over time, especially after pandemic, people have become more interested in this term and then probably become more aware of this term as well. So conclusions. Most people do understand the core idea, the interconnection, right? Despite some variations. And then the pandemic did seem to raise people's awareness and interest. And the final point for discussion is, right, when we think about One Health and then climate change, right? So when we think about climate change, it's more politically polarized, right? So it's, for some people, it can be very negative, right, about climate change, like believe or not believing in climate change, and that lead to polarization and then not helpful in terms of promoting actions, right? So one way to think about whether we should promote One Health as an alternative to climate change, to promote actions surrounding climate change, right? So essentially, climate change could also about health of the planet, health of people and animals and the environment, right? So that's kind of like a final discussion point. Thank you. Thanks.
Okay. Well, thank you so much, Cary. That was very enlightening. Let me start off with a question and let others think about this. So you mentioned that in China there were up to 15 different terms for One Health.
Yeah.
So did you have any sense that did that create any ambiguity, or is that more like a regional thing? Like some regions maybe use certain terms more than others, or?
Yeah, so I try to, so this part of the project, but that's the first paper I'm trying to work on, is really think about not just China, but the translation in non-English society, how in the policy document, in the news articles, and how that translation and the differential translations and how that lead to a certain challenge promoting and implementing the approach, One Health approach, right? So we look into the timeline and then look into all those documents and find this lot of different translations, and we're trying to figure out why, right? So one is because it's relatively, as a term, it's relatively new, and then when it was introduced to China is this conferences, and the students, journalists, they they went attended to that conference, and then they translated based on their own understanding about this concept, One Health, and then they publish, and that lead to different translations, and then there's no kind of like from government or health organization, they come out and really, okay, we need to have unify or find a way to kind of common translation. So that will help with raising people's awareness and also promote collaboration across disciplines and across sectors, different departments. But if I ask about in Spain or some others in France, they also identified multiple translations, right? So we are trying to work and trying to interview people like how this diverse translation might lead to make it more challenged or difficult to really promoting this. But we have some interview data, but we have not yet really turned it into evidence. Okay, this could be a bigger challenge and difficulties.
Yeah, and I noticed that the conference was 2004, and actually SARS was 2003, 2004. So I wonder if it had something to do with, that pandemic, and because that was a zoonotic spillover as well.
Yeah.
Yeah, and then of course we had COVID and another potential opportunity for that to happen. So yeah.
Yeah, so I look into the regional variation about the search of term.
Mm-hmm.
Yeah, the Hong Kong 2004-5, the search is quite high relatively, right? But I didn't show today, but that probably related to the
Oh, I see. So there is regional variation.
Yeah, there's some regional variation, right? But it was the other point is that not just mainland China they speak Chinese, but in Taiwan, Singapore, and Hong Kong they also use Chinese quite in writing, and then they also have multiple different translations.
Right. Yeah, it'd be interesting to look in beyond China and other countries.
Yeah.
See that variety of terms as well. So
yeah, it was also translated in different terms in Spain and Spanish, in French, Yeah.
That'd be interesting to do some kind of a comparison, but that's future research. Yeah. So, are there any other questions? Anyone in the room or online?
Question.
Okay, Harvey. Yeah, please go ahead, Harvey.
Yeah, I'm very intrigued by One Health and sort of thinking about it, like why the concept, why now? It's 20 years old, I guess. And as you present it, it's largely framed out of a Western perspective on health. And are there scholars looking at the broader traditions? For example, look at indigenous wisdom and the construct of all our relations, and that's the inherent interconnectedness by all our relations. It's not just your personal relationships, it's with these sentient being, it's with the earth, with the cosmos, with the spirit, and the medicine wheel is one way of kind of enacting a lot of the different sort of constructs of that. So that's a long-standing understanding, wisdom-based. Similar, if you look in Eastern traditions, and example be Buddhist teachings, and then the concept of interbeing as promoted most recently by Thich Nhat Hanh, and it's sort of there like for thousands of years, this notion of all these interrelation, interconnectedness. So when I hear about One Health, I find it interesting, but is it being placed in this broader context? It's since not new. I guess it's maybe new from a Western idea perspective. And why has it taken us so long in the West to come across this perspective where other traditions go back thousands of years?
Yeah, so very interesting, really to think about the idea of One Health is really long-standing in Western, but also in other parts of the world. But I think why it's becoming really think about why it's becoming really important to think about One Health is more not about the idea. People are aware of the idea, but it's more about the actions, a policy framework that, for example, we need to work together. We need to bring different, like you mentioned about indigenous wisdom, or how they think about health in general, right? And how different ways of approaching health and thinking about health, right? So that's cross-disciplinary thinking, and then also cross-sectoral in terms of like actions, right? Idea, essentially, like you mentioned, long-standing, not just in the West, but also in the East, probably 1,000 years of thinking like Chinese Buddhist culture about like the harmony of the heaven and then the earth, right? Thinking about that. That's like 1,000 years ago thinking, philosophy of thinking about people's health connected to the environment and then to animals, but action, right? So One Health and not more is about really action. Like even we have these ideas, but in actions, there's a lot of like different departments. There's a lot of working only within themselves, and there's no collaboration at local, even international. Thinking about the pandemic, how pandemic, we think about how to work together to prevent the next pandemic, and that's One Health in action. Mm-hmm. Work internationally, right? But pandemic lead to more polarization and international conflict, not One Health.
Yeah, you raise a really good point, Harvey, if I might just add, is so one of the colleagues on another project, Sean Hillier, who is Indigenous, he always emphasizes that this is as Harvey, as you were saying, that Indigenous people see the world that way through, they use a One Health lens instinctively. They almost are the originators even before, a medical kind of approach to it. So in a way, we almost have something to learn from them, right?
Yeah.
I'd suggest, Mary, we have a lot to learn because it's been inherent wisdom for century, and the practices that fall out of that, certainly indigenous wisdom of how to deal with our planet. I mean, we've got the solutions. Regenerative agriculture has been doing that. And similarly, the practice that come out of Eastern thinking of mindfulness and that, there are some powerful practices that can be very useful of how we're going to address, the climate crisis we're in One Health. So I see it as a pragmatic function if it organized Western people to take action, but I just get concerned if it's done in isolation of these huge long traditions and whole sets of practices, holistic, integrative, and there's a lot of wisdom and the increasing research around that base. So that was just my concern. If it looks like it's kind of a new kid on the block, and I think there's a lot to gain by having it more deeply grounded in these other traditions.
Yeah,
sure.
Agree. Yeah.
Yeah, I recall just on that note. So Deborah McGregor, who is Indigenous scholar in law and environmental studies here at York, she was giving a presentation on Indigenous approaches to research, and at one point she posed the question, how would you feel if you knew the earth loved you? And it was just, such a profound question that, but it changes the way you think about everything in life, right? And so I think, Harvey, it's that kind of profoundness that we can really learn from. So, yeah. Hillary, please go ahead.
Hello. Yes, thank you so much for your presentation. I don't know how to phrase this question exactly, but it was something that you sparked kind of in a couple moments of your presentation, particularly around kind of the frame of One Health as a less antagonistic frame than, say, climate change, which can be very conflictual and very polarizing. I wonder how that rests with the need to address some of the root causes of our current planetary crisis, in a sense. I'm thinking about capitalism, colonialism, kind of the structural conditions which make One Health so necessary in our shift of thinking. So yeah, I would wonder, there isn't really a specific question there, but I wonder if you could say more about how the frame of One Health as a tool for change comes up against kind of the conflict that is inherent maybe in how we need to change. Does that make sense?
Yes, I've been thinking this quite a lot, really, like how to promote actions. And then one way of promoting action is we need to have a very simple theory or very simple approach. I think we are trying to get into the One Health approach. First is make it very simple, right? So fast and the simple theory, only when we have that, and that lead to focused actions, right? So for example, when we think about One Health, it's simple enough, two words, and then all those healths are interconnected, like the environment, animals, and then all those. And a lot of bad things happen, like you mentioned, all those social troubles, and then a lot of different like global forces that lead to all those inequality, crisis, and the pandemic. But if we do not have a simple theory, it's become we lost in all those social world problems, right? So one simple way is One Health as a theory or as a simple approach, and the people aware of that, the interconnection, and then we take actions working, like including the public, right? We change over health behaviors, health lifestyle, and then for policymakers and then political leaders, and thinking about how to collaborate with different internationally, community, multi-sector, bring different departments together. And then for research is also when we think about One Health, like I research about political support in general and how that related to health of people, for example, and not just like you have to research about health and thinking about One Health, but also thinking about even the conflicts like we are facing now. Think about the war out there. If we have this One Health conceptualization, and then like how everyone's health is related to your health, your family's health, and that simple, like Mary mentioned about that the Earth's health will make you healthier, right? So that thinking will. So the key idea is those simple approach and unifying approach will lead to focused common understanding and focused actions, and that will help to address all those social conflicts I was thinking.
Thank you. Thank you very much.
Great question. Yeah, on that note, so Cecile Ennishlason, who's on our project as well, she's a veterinarian researcher, epidemiologist in Quebec, and she was chatting with some colleagues in the medical profession, and they were saying around One Health, they were saying they don't use the term One Health, they prefer to use planetary health. And I'm a political scientist in terms of my theoretical lens, and I thought of this as being very political because, One Health is almost, it's an invitation to align our practices with, those of animals and the earth and so on. If you say planetary health, it's maybe a little bit more remote. It's kind of a less of a call to action to actually do something. Anyways, that was my interpretation, and I just thought, wow, that's a challenge if you can't get all the professions to agree to a term even.
Yeah, so that's a very good point. Why maybe I haven't thought about it. Like I was thinking about the differences about the concept of One Health and the planetary health. Mm-hmm. And we all out there we have all those One Health journal and the planetary health journal, mm-hmm. and all those efforts, right? So which term is better? Some people prefer planetary health, others prefer One Health, and those differences could lead to diversify those actions too, right? So that's why, just going back to earlier point that the simple unifying approach will help focus actions that lead to change.
Go ahead. Yeah.
Christian, thank you. With your presentation, when you got to the data from Beijing,
Yeah.
you made mention that people of low income earners in Beijing had a greater awareness of One Health.
Yeah.
Can you elaborate more? What were the factors that contributed that? Like, how did you come about that?
Yeah, so that's a very interesting question about the demographic of like One Health and wellness. So in general, the finding is that younger people, more educated, and happen to be lower income categories, so they are more aware of One Health rather than people who have higher income, older.
Is there any particular reason? Because I'm trying to wrap my head around it. Because ideally, people who are wealthy are supposed to, we know they are supposed to get much more information.
Yeah.
They're supposed to know as compared to people who are of less income, because they wouldn't be able to get access to much education than those who are wealthy. So I wanted to find out if what really came about them, rather being aware of the concept of One Health than those that presumably are able to get much more educated or get information.
Yeah, so in the model, we did control education. So yeah, could related to education, but the point I'm trying to get is probably is related to the age, because they are younger, so they are not working, so they have lower income. And then they probably, like university students, the majority of the group, and then that they are more aware than people who have more income and richer or live. And the other reason probably that if I don't have answer for that, but probably because maybe younger people, they do more care about the environment relatively than older in China. Yeah, younger groups, they do because they are more exposed to Western cultural media and like ideas. And then the One Health being as a term being like, for example, not the idea, but the term in general as an imported approach, they could be, that could be the reason that why they are more aware.
Thank you.
I actually had a question. So it's sort of related to Heather's question and a point that I saw at the end of the slide. So it seems like, so a couple things. The public awareness about One Health is kind of low. But when people are made aware of what One Health is, they have a very positive association with the concept. And right now it seems like climate change is a very polarized term, but One Health is not so much. Is there a worry that as One Health becomes like more widely known, now with the profusion of conspiracy theories, is there a worry that this idea could be taken and twisted into something that it's not? And you'll face pushback on this idea, on this concept, on the implementation of One Health?
Yeah, so I don't know like whether like it might go in that direction, but the good thing about like Mary mentioned about One Health is really related to overall health, right? So climate change is far like you don't have to care about climate change if you just care about yourself, right? But One Health is about your health and the health of people surrounding you and the health of the environment you live in. And that could be a better way, or maybe will even like in the future when it become very popular, will be less polarized, because you cannot deny, right, those health is important, right? But now climate change, people deny or like they don't believe climate change is happening. Right, but One Health is that, okay, your health, because this based on our everyday understanding about life and social and individual behaviors, right? So overall health indeed related to, like, for example, especially people who have pets, for example, cats and dogs, and they probably have better understanding about the interconnection of the health, and that maybe potentially, so that's what I'm trying to say potentially the term will be less polarized in the future, and then maybe a better way of unifying people for actions. Yeah.
Personal then, like.
Yeah, it's personal.
Your personal health and like the health of your pet, say.
Yeah.
Okay.
So that's the differences. Mary mentioned that, like different from planetary health, right? One health. So that's, but I don't have an answer for that. Yeah.
Because it's quite difficult to predict like what people will take and turn into a conspiracy theory, right? It's just something I've been thinking about a lot because like for example the concept of 15-minute city, it's such a simple concept and it's very positive. Like like if it were implemented, it would be very positive for not just like people but for the environment as well. But like that idea has been taken into like a completely like outlandish direction of like, oh, the government wants to trap everyone. But I just feel like now in this like climate, it feels like everyone like research has to be kind of defensive in a way.
Yeah.
I'm not sure if you feel that way, but it's just something I'm thinking about.
Yeah. A lot of things today is really about story and narratives, and like positive story narrative more likely to lead to action and promoting people working together, but negative stories will lead to more conflicts and divide. Yeah.
So I have one more question. So, following the COVID pandemic, in China, the wildlife trade markets were closed. They were, I guess now they are banned pretty well. I guess the idea being to try and prevent zoonotic spillover. And were there any comments or, I guess this understanding of One Health could help support those kinds of regulations that the government put in place. Do you have any thoughts on that or anything come out of your research related to that?
Yeah, I think in China there's small group like here, small group of people really trying to promote that concept, One Health, and then they also training students. Like I think there's quite a few universities they have now One Health major. Yeah. And then they build a One Health institute.
In China?
In China.
Okay.
Yeah, trying to promote One Health actions and also training students that bring different disciplines together and then trying to build a transdisciplinary One Health as a major. So they have graduate students, undergrad students in One Health, some university. And then at the Beijing CDC, they also have One Health department now. Yeah, so they have this promoting. And there's a journal created in China called One Health Bulletin. So they have shared this like every quarterly, I think they publish some One Health related research, right? So it's becoming bigger and bigger. We have, in this project, we have interviewed quite a few experts in China working on the One Health,
Yeah, that's really exciting, actually.
Yeah,
we need that here.
Yeah.
I mean, I know Guelph has now has a One Health program, or is it Waterloo? I can't recall. I think it's Guelph.
Guelph,
Yeah, but there's no medical school there, right? There's just a veterinary.
Yeah.
So
but huge. Guelph, like One Health, I look at their website. It seems like there's lots of people and.
That's great. Yeah. Well, they do agriculture, right? And veterinary. So. But I think in Canada it would be great to see it become more mainstream within other health-related professions.
Yeah. So trying to promote One Health as mainstream for all countries, and that only that way that really like help the implementation. Of the approach.
Yeah, but I guess having that basic understanding of the concept is the place to start.
Yeah. The first step, I think.
Yeah. Great. Any other comments or questions? Okay, if not, well then, Cary, I would thank you so much for that really fascinating presentation and so much research there that I'm sure will probably generate more publications. So I thank you, members of the audience, and look forward to seeing you at our next seminar, which is Creating and Resisting the Humanitarian Development Complex with Agnieszka Soboczinska from King's College London on Thursday, November the 16th at 2:30. So thank you again, everyone, and closing the seminar.
Thank you for joining. Thank you.
Thank you.